Been increasing calls by some doctors for government to impose a stricter lockdown. This as the country deals with the second wave of COVID-19 with thousands of infections daily. Now let's discuss this with the chairperson of the South African Medical Association, Angelique Coetzee. A very good morning to you, Angelique, and thank you so much for your time this morning. So how would you think that stricter lockdowns would assist when we've seen, people flouting the regulations in this country?
Good morning, and a good morning to all your viewers out there, and thank you for asking our opinion. From SAMA's side, we can bring in, and we have said it many times before, we can bring in the strictest regulations. If it's not being enforced, it will not help. So at the current moment, what is extremely important is to start bringing in enforcement regulations with people going to shopping centers, malls, after parties where they do not adhere to wearing their masks, or there are too many people between four walls. We have now decided to break away with saying inside. We are now saying anything that any room that you have that's got four walls around you, you have to be extremely careful, and you should actually try to get out of that environment as quickly as possible, especially if you see it's more than 50% full with the people. And it's not too difficult to see that with your own eye if you go and see at the mall. So again, we need to change behavior in our country, and we need to look out at our borders. As much as England is accusing us, I find it quite laughable, because England's got their own variant that's there. They can't blame South Africa for our variant out of 501. It's just a blaming game at the end of the day. But we also need to be careful what we can bring into our country, because there's more than one variant of the virus, and that is important to understand.
So how strict a lockdown is SAMA calling for, Angelique? I mean, we've obviously gone through 5 levels of the lockdown. So at what level do you think is strict enough to ensure that we're dealing with the second wave properly?
I think level 2 would be fine. But again, you need to make sure that you can enforce the regulations that is there at each level. And I think it's starting to get important to let people, and they need to be educated what regulation 2 means to them and to their family. What we find in the surgeries and at casualties and at hospitals, people still doesn't understand that that is actually a COVID hotspot. Every surgery, every hospital, every clinic is a COVID hotspot. So you do not go with all your family if one needs to go and see a doctor. It's only the person, the patient, that needs to be there. And you can be fined. The facility can be fined. If you float that regulation and you bring the family in and there's an investigation, or someone come and inspect your surgery or the casualty or the hospital and found people sitting there that's not the patients. And I think people need to start to understand this. It's all about behavior. We've got a very, very poor adherence to behavior.
Angelique, there have been, questions from citizens and public saying that, is it really the fact that lockdown is not being adhered to, at least the protocols, or is it because this second variant is quite harsher? So is it maybe a question of we're blaming the wrong reasons, or we're blaming the wrong people or the wrong things for this spike in numbers?
No, unfortunately not. If you go into any shopping mall currently, go this morning, send a team in, and you will be astonished to see what is happening there. You will see the non-adherence. And I think it is time that maybe if you go into a shopping center or a mall with your whole family, and you don't need, just go for shopping. It's not an emergency shopping. I think there needs to be some repercussions. Because how are we going to change this behavior? Unfortunately, there's still a problem at the hospitals regarding lack of oxygen, lack of enough staff, lack of MO posts being filled. So, but that is a problem relating capacity to treat these people who doesn't wear their mask. We keep on enforcing the regulations on the hotels and the rest of the industry that is easy. I call them easy targets. But unfortunately, any restaurant or guest house, for them to become an easy target, you have people coming into that facility.
Yes.
And we need to get people to wear a mask. Guys, if you wear your mask, it's not that difficult. Just wear the bloody mask and stay away from people. It is very, very easy.
Yeah.
And that's what we have.
Well, has the health system been ready? Was it ready for this second strain, the second variant? I mean, there's always been talk about the second wave coming, but I suppose people didn't think there'd be a second variant that would be coming as well. Was the health system ready for it?
I don't think there's any health system in the world that is ready for the influx of patients that you are seeing. So our healthcare system is struggling. It was struggling before COVID-19 happened to us. It's struggling even more in this. And I think what we see now is that a lot of the CEOs of hospitals and the supply chain that is supposed to order PPE or order the necessary equipment are sort of paralyzed because they also are afraid to be accused of corruption. So now we are seeing not enough stock coming into the hospitals, especially the public hospitals. And that, again, as I've said, it makes it worse. And yes, this new variant is very transmittable or contagious. That's a better word for the average person out there. It's very contagious. It's highly contagious. We will now need to start testing some of the children as well to make sure, because up till now we didn't really test the children. We tested the predominantly people, elderly people that might be at risk. But we'll have to go to the rest.
Of course. Dr. Angelique Coetzee, thank you very much for your time this morning. She is the chairperson of the South African Medical Association.